Smokers could be offered free e-cigarettes on the NHS as part of new plans to help millions of Brits quit for good. But what else can you do to help stub out cigarettes once and for all? Although the rate of smoking in the UK has been declining steadily since records began, there's still a lot of people puffing away and putting their health at risk. The UK is home to more than 6 million smokers, and cigarette-related illnesses are still the leading cause of death in England. In 2019 alone, they killed 64,000 people. New plans could see smokers able to access free e-cigarettes through the NHS in a world-first attempt to help yet more Brits quit. Makers of vaping devices can now submit them to the Medicines and Healthcare Regulatory Agency for assessment. The devices could then become licensed medical products, able to be prescribed to help beat addiction to smoking. E-cigarettes contain nicotine, but not tobacco, and although they carry their own risks, are considered less harmful than smoking. They've been shown to be highly effective in supporting those trying to quit, with 27.2% of smokers using them compared with 18.2% using nicotine replacement therapy products, such as patches and gum. But they're not the only tool you can use. So here's a few more tips to help you stub out for good. Think of your wallet. Smoking can be a very expensive, let alone deadly habit. One good way to motivate yourself to quit is to think about how much money you'll save by doing so. The average price of a 20-pack of king-size filter cigarettes in September 2021 was £11.40, and that is set to increase as the Chancellor slapped yet more tax on cigarettes in his most recent budget. That means if you're a pack-a-day smoker, quitting would save you more than £4,100 in your first year smoke-free. 10 years on, you'll have saved more than £60,000. That's a deposit on a house. Another way to wean yourself off cigarettes is by changing how you ingest the addictive ingredient, nicotine. You can access nicotine replacement therapies through your GP, stop smoking services, or pharmacies. These may include nicotine patches or gum. The NHS also recommends giving e-cigarettes a try, saying although they're not risk-free, they are significantly less harmful than cigarettes. Get active. If you're experiencing cravings, one way to help distract yourself is to get up and about. Researchers say that even 5 minutes of walking or stretching is enough to cut cravings. Change your food and drink habits. Scientists have found that certain drinks can make cigarettes taste better. These include fizzy pop, alcohol, cola, tea, and coffee. So by switching your favourite tipple or swapping your favourite flavour of morning brew, you may find it helps to stop you reaching for the fag packet after that first sip. Researchers in the US have also found that some foods, including meat, can make cigarettes more satisfying. Things like cheese, fruit, and vegetables, however, can make them taste disgusting. So maybe try swapping your usual steak or burger for a veggie pizza instead. Remember that you're not alone. The NHS says you're 4 times more likely to quit if you have the help of a local support group. Across the country, there are plenty of groups you can access to meet people in a similar situation. There's a link in the description to point you in the right direction.